The next we are going to discuss is the denture injuries. As we all know that the oral mucosa, it is subjected to various kind of injuries as a result of wearing of artificial denture. So these injuries may be specifically as number 1 traumatic injuries, generalized inflammation, inflammatory hyperplasia, papillary hyperplasia of palate, or denture base or allergy. So let us discuss them one by one. The first comes the traumatic ulcer, that is also known as sore spot. So the traumatic ulcer, it is caused by denture irritation. So it is a kind of physical injury. This denture ulcer, it occurs, it develops within a day or 2 days after the insertion of the new denture. So why it occurs? It occurs due to the overextension of the phalanges or the spicules of bone that are present under the denture, or a high spot on the fitting surface of the denture. So these ulcers will be small, painful, irregularly shaped, that are covered by delicate grey necrotic membrane. So what is the treatment for this traumatic denture ulcer? The treatment of this traumatic denture ulcer, it consists of correction of the underlying cause. Now what is the cause? The cause, it could be the overextension of the phalanges, that is corrected by giving the relief to the phalanges, or the sequestration of the spicule of the bone under the denture. So that can be corrected by removal of any tiny sequestrum, or there could be the high spots that are present on the fitting surface of the denture. So we can correct them by giving a relief of giving them a relief of these high points. So when the cause is removed, the ulcer will heal promptly. Second comes the generalized inflammation, that is the denture sore mouth or denture stomatitis. A denture sore mouth is an uncommon condition that occurs in patients who may or may not have a new set of denture. Some cases of denture sore mouth, they are related to the infection with the Candida albicans. So the poor denture cleanliness is associated with a severe inflammation. Other causes can be continual denture wearing, poor oral hygiene habit. Now what will be the clinical features? The denture beneath the mucosa will become extremely red, swollen, smooth and painful. Severe burning sensation may be seen. The redness of mucosa is rather sharply outlined and restricted to the tissue actually in contact with the denture. Now what comes under the treatment part? In the treatment part, you can give antifungal therapy. In the antifungal therapy, you can consider nystatin tablet that are allowed to dissolve in the mouth 3 times a day for 14 days. That will treat the denture stomatitis. With the nystatin powder can be placed on the fitting surface of the denture 3 times a day. That will give good result. In case the denture fits poorly, then the construction of new denture can be made. Third is the inflammatory hyperplasia. What is the other name of inflammatory hyperplasia? It is Epulish fissuratum or denture injury tumor. So in this disease, what you will see, a ill-fitting denture will cause hyperplasia of the tissue along the denture borders. So such hyperplasia of the oral mucosa, it will be not restricted to this location, but it may occur in many areas. So in the inflammatory hyperplasia, what you will see is that there will be the denture injury, that is due to the result of denture injury, and it is characterized by development of elongated rolls of tissue. As similar, you will see a development of elongated rolls of tissue in the mucolabial or mucobuccal fold. into which the denture flank that will conveniently fits. So this proliferation of tissue is usually slow in developing, and it could be the result of resorption of the alveolar ridge that uh, that uh, that could be the cause of ill-fitting denture and causing the elongated rolls of tissue in the mucolabial or mucobuccal fold area. So in the histological appearance, what you will see is excessive bulk of fibrous connective tissue that is covered by a layer of stratified squamous epithelium that may be of normal thickness or show acanthosis. Pseudoepitheliomatous hyperplasia may be seen. Now, what is the treatment of this inflammatory fibrous hyperplasia? It should be surgically excised, and either a new denture shall be constructed or rebasing of the old denture shall be the treatment choice. If the denture is replaced or it is repaired, we will see that lesion will not reoccur. Next comes the inflammatory papillary hyperplasia, or other name is palatal papillomatosis. Papillary hyperplasia, it is unusual condition involving the mucosa of the palate. So it is associated with ill-fitting denture that permits frictional irritation and poor state of oral hygiene. This papillary hyperplasia, it will occur in the edentulous patient with the dentures. Constant wearing of denture is one of the most important factor associated with this condition. So what you will see is the lesion will present as numerous, closely arranged, red edematous papillary projection involving all of the hard palate and imparting as a warty appearance. So the treatment, there is no well recognized treatment. Discontinue the use of ill-fitting denture or construction of new denture without surgical removal of excess tissue will generally result in regression of the edema and the inflammation. The plasticizers of the soft liners, they can be cytotoxic and affect many cellular metabolic reactions. So a true allergy to denture based material, that is extremely rare, and these allergy that can be due to the sensitivity to the monomer that is both regular and self curing type.